We've mentioned raised intracranial pressure in so many of our discussions, but we haven't actually taken time to actually talk about raised intracranial pressure as a concept of its own. Do you understand? So in this video, we'll be doing justice to raised intracranial pressure, and basically we'll be talking about the features of raised intracranial pressure, and we can't talk about the features of this condition without defining it. Do you understand? That's why I said we are going to actually make justice to this. All right. So what is our focus for this video, or the question we are trying to solve up in this video, is to discuss features of raised intracranial pressure. All right. Features of raised intracranial pressure. All right. Basically, you could say clinical features of raised intracranial pressure. Right. So what is intracranial pressure? Intra. What is intra? Intra means inside. What is cranial? Cranial means cranium. Cranium means skull. Do you understand? Pressure means what? Increased force or something. Do you understand? So intracranial force, intracranial pressure, it means that, okay, there's so much pressure in the cranium more than what is supposed to be there. Do you understand? So raised intracranial pressure, and we're talking about the features. All right. So if raised, okay, in raised intracranial pressure, you can have headache. Okay, the patient can complain of having headache. All right. So if the patient complains of having headache, you can suspect raised intracranial pressure, but you are trying to look at the type of headaches. You are trying to look at the characteristics of the headache. Do you understand? So you could have the patient telling you that, okay, they have early morning headaches. Okay, and they have headaches that improves along the day. Do you understand? Then the patient can have nausea and vomiting. Nausea and vomiting. All right. Nausea is basically like you feeling like you have a feeling of vomiting. Why vomiting is actually the process, right, of expelling abdominal contents, all right, through the mouth. Okay. So nausea and vomiting. All right. So you could have these symptoms early in the morning. Okay. Or if you change in some position, right, if you sleep in some position, then you are having feelings of vomiting or you are vomiting. Okay. This could be suspected and be intracranial raised intracranial pressure could be suspected. All right. Or okay, yeah, raised intracranial pressure. We call it ICP. Okay, this ICP is basically the intracranial pressure, right? Okay, so visual disturbances, uh, visual disturbances and changes in mental status, all right? So somebody that has a raised intracranial pressure could have diplopia. Diplopia is double vision, you seeing 2222 and all that, okay? You could also have blurred vision. Blurred vision is like, okay, you are not really seeing clear. Do you understand? Then visual loss, okay? Visual loss. Visual loss is basically like, okay, totally you are not seeing again. All right. So these symptoms could also indicate other disease conditions. All right. So there are further investigations that I can do to actually verify that, okay, this is actually raised or increased intracranial pressure. Do you understand? So you could see headache, confusion, shallow breathing. Okay, all these are symptoms of increased intracranial pressure, and we also have increased blood pressure, right, also as a symptom of increased intracranial pressure. All right, so changes in mental status, the patient will be confused, they will have lethargy and will have coma. All right, some patients could go off. All right, they are not in their normal state again. Do you understand? Then papilledema is basically like the eyes will be popped out and all that. All right, not really popped out. It could be that, okay, there's inflammation at the back side of the eye. Do you understand? Yeah, the eye will be popped out, but it's accompanied with inflammation. Then changes in vital signs. You have Cushing's reflex and response. The patients who have hypertension, the patient could have bradycardia. That's basically reduced heartbeats. All right, tachycardia is the increased heartbeats. Okay, so there's irregular beating, Keim-Stokes response. Okay, as it about all the features, clinical features of increased or raised intracranial pressure. All right, and we spoke about this under the diseases that can actually affect the central nervous system. All right, so we move ahead, guys, and see you guys in the next tutorial. Bye for now.